State senators return from their summer break, and one of the first items on their agenda, deciding whether to go along with Governor Snyder's plan to expand health care coverage for low-income residents. And after hours of closed-door meetings, the Republican-led Senate rejected the measure by a single vote. It is a debate that has Republicans disagreeing with the governor from their own party. NBC 25's Josh Marshall has the late-breaking details. Josh.
Jane, the close decision could have meant two very different things for hundreds of thousands of Michiganders. However, despite continuous support from Governor Rick Snyder, Michigan will not expand Medicaid coverage. Michigan's Medicaid expansion plan would provide health care to 470,000 more people in the state. People who come to places like Genesee Community Health Center, asking questions about the change in health care coverage.
About half of our clients are homeless, and about 98% of them live below 150% of the poverty level.
The plan is part of the new Health Care Reform Act, which provides federal money for states expanding the use of Medicaid coverage for the poor.
Changing that whole reimbursement structure so that these folks understand that they have options beyond that last-ditch care.
Tim Lawther says emergency room care is expensive and time-consuming, something that Governor Snyder agrees with. In a June interview, Snyder says he opposes emergency room care as an option for those not included in Medicaid expansion.
It's a terrible answer. They could be in a primary care relationship, they could get a physical, immunizations.
Groups opposed to expanding Medicaid argue that stretching federal dollars even further is an expense Americans can't afford.
The question is, are we going to pay extra state dollars to enact the law as we have to enact, or are we going to take advantage of the federal dollars to do that?
With 470,000 Michiganders now exempt from Medicaid coverage, they can still qualify for the health insurance marketplace that gives people federal subsidies to be able to afford private insurance.